Hi,
Yeah.
welcome to the People First training session on basic first aid and emergency disaster preparedness. So this morning, we're actually going to do first aid first, and then we'll do a 10-minute question answer session. And then we'll move on to disaster and emergency preparedness and a 10-minute question answer session then. Welcome everyone to People First Conference. And my name, of course, is Kellen McLean. And I'm a certified American Red Cross instructor, and I've been doing it for about 17 years. So it's something that's really a passion of mine, and I enjoy it. And I want to thank Liz Ford for inviting me to do this and welcome me back. Those of you that know me, you may have been, you may have taken this class before with me, but hopefully we'll learn some new things today. Okay, I'm going to introduce Connie Delaney because she's going to be my victim today. So we're going to do a few things with her, and she's also going to be my Vanna White. So I'm going to take it over to Connie, and Connie's going to tell you a little bit about her.
My name is Connie Delaney. I'm also on the board. I've worked probably 28 years with people with IDD and DD, and I work with children, helping them also find resources throughout the communities. Kellen and I have been involved with People's First since 1998, when Kevin Smith was organizing People First chapters in Ohio and West Virginia.
Yeah, it's a passion close to our heart. So thanks for having us back today. Okay, well, there's several things that we need to know before beginning to act in an emergency. With a loved one, it could be a friend, a neighbor, your caregiver, or another self-advocate. You could even be at the conference when we actually get back to being in person with the conference. You could have an emergency right next to you. You never know when an emergency is going to hit. So there's quite a few things that we need to learn. So let's get started. We always want to do three things first when we're talking about first aid or an emergency. And the Red Cross calls those the 3 C's, and they're fairly easy to remember, and Connie's going to show you. But I don't know if you can see this, but it's going to be check, call, care. And I'm going to tell you how those actually apply to first aid. Okay, so when we're actually checking, we want to make sure that we check the scene, because you have to be extremely careful that in the event of an emergency and you see somebody struggling or needs help, that you aren't injured in the process of actually helping that person. If it's too unsafe for you to approach, or it's a situation that you don't feel comfortable with, it's okay. If the most you can do is call 911, that's great. You've done your job. Okay. So when we check the scene, we want to make sure that we check to see if there's any down power lines, water. Is there bleeding? Has a person hit their head? Do they have an obvious visible injury like a broken bone? It could be a number of different things, but you want to make sure that you check the scene for safety, and then you're going to check the person. And the best way to check with the person is to actually ask them if they're conscious and they can talk to you. Make sure you ask them, hey, what happened? Did you fall? What was the emergency? Because you may not have seen what happened to this person. You may just see the aftermath of what's happened. So you need to be careful with that. But you want to check the scene and then check with the person. If they are awake, ask them what happened, where it hurts, are there visible signs of injuries again. Now, this is an important tip for folks. And the Red Cross is very serious about this, because this is where you get into legal wranglings, and not to get too detailed with it, but when you actually approach someone, especially someone that you may not know personally, but you want to try to help them, you always want to say, hi, my name's Kelly. I'm trained in first aid. Can I help you? And if the person says, yes, I'd really like help, 9 times out of 10, people will actually, they'll actually accept the help. There may be somebody that says, no, I don't want any help. Just leave me alone. But we're going to move on to the next step, which would be, of course, call. Okay. So if they actually say that they want the help, sure, proceed, and you can help them as much as you can. And we're going to get into that in just a minute. But if they say no, don't touch them, but move on to the second C, which is call. Call 911 and get help on the way immediately. And like I said, if you actually call 911 and get help, no matter the emergency, you've done your job for the day. So I just want to make sure people realize that. Now, when you call 911, there's several things that you need to know. And if you've ever called 911, you know that they ask you a lot of questions. So, you know, you want to make sure that you're actually familiar with where you are. Is this your home address? Are you out in the community somewhere? Are you at a park? Are you at the community pool? Are you at the office? You know, are you at your own home, a friend's home? Just always know where you are so that you can tell the 911 dispatcher where you are and how to respond to the emergency. They'll know where to find you. Okay. So also tell the 911 dispatch folks what happened, as much as you know. You could say, hey, I was at the park and I saw somebody fall and they've hurt themselves. There's a lot of blood, you know, hey, get here quickly. And of course, they'll ask you some more questions as well. So you want to make sure that you stay on the phone with 911 for as long as you possibly can, and then go back and we're going to do the third C, which is care. We're going to care for the person. So if you're able to help the injured or sick person, and they want you to help, proceed with helping. Stay with them until the help arrives. And of course, 911 will always tell you that. Stay with the person until help arrives. And that way, you know, you can keep the person calm, you can keep them talking, you can keep them conscious for as long as possible. Now, the first thing when you're responding to an emergency, the most important thing really is staying calm yourself. And it's hard when you're in an emergency because people get nervous, they get upset. Not everybody's cut out to see blood or injuries, but stay calm. Stay as calm as you possibly can, because if you're calm, then the person that you're trying to help is going to be calm as well. So keep that in mind. Okay. Now, we're going to move on to some first aid tips. Okay, the first thing you want to do, like I mentioned before, is survey the scene. Make sure that you know, are there any things that is going to impede your helping this person? Is it going to cause an injury to you if you actually help this person? And if you don't see anything or any injuries that you might get or any ways of injuring yourself, then proceed, you know, offer some help. So survey the scene, always look around, you know, if there's any other bystanders that can help you. People were actually willing to help in an emergency if they know what to do. So you could say, hey, go to the corner, you know, by the stop sign and wait for the ambulance and show them where we are if you're somewhere out in public. So always survey the scene and be ready to, receive the emergency response folks. Okay. When you're surveying the victim, if the victim is conscious and talking to you, make sure, I'm going to use Connie as my guinea pig here, but make sure that you tap them on the shoulder or the arm and say, hey, are you all right? Where does it hurt? What happened? Is there any visible injuries? Did you hit your head? Those are all things that can be potentially dangerous and life-threatening. So you need to be aware of that. Okay? You tap and shout, say, hey, are you okay? Make sure you actually put your ear up to the person's mouth and nose. And, all you're doing there is just simply making sure that they're still breathing, especially if you go up to someone who might be passed out and unconscious. You want to make sure you approach them and actually check for breathing. And all you do is just put your ear down to their nose and mouth and listen for sounds of breathing. So it's fairly simple. So then you're going to look, listen, and feel. And you touch their skin. Is their skin clammy? Is it sweaty? Is it cool to the touch? Is it hot to the touch? Those are very good tools that you can use to be able to tell the 911 folks what's going on and what you've observed. Okay. All right. So we're going to check for bleeding. We're going to check for breathing issues. And then, of course, we're going to move on and we're going to give first aid care. So we're going to treat the injury, treat for shock, telephone for help. Now, we'll get in a few minutes, we'll talk a little bit more about shock and what to look for. But shock is a potentially life-threatening condition. So you need to be aware what that looks like and what to do, okay? There's very little things, there's just a few little things that we can do in the field which is, outside of an emergency room, et cetera, and, getting help at the hospital. There's just a few things that we can do to help that person until help arrives, until the EMS folks get there. Okay. So we're going to call 911. And again, make sure that you let them know this is an emergency call, and then tell them what you've observed, what you've seen, what you know about the person, or what they've told you. Okay. Now, if the person is unconscious and you're not really sure what's wrong with them, but if someone is unconscious, that's a potentially life-threatening condition as well. So you want to make sure that you get EMS on the way and get them there as quickly as possible, because the faster you respond, the faster you'll get help. Okay. Now, when you talk to 911, just who, what, how many, and where. So tell them as much information as you possibly can, and of course, move on to any other questions that they might have for you. And they will have some questions, but don't hang up on the 911 dispatcher. Okay. They will tell you when it's safe to hang up, or they'll tell you that help is on the way. They might even tell you to, put somebody prominently, like I said, at a corner intersection or a stop sign, to keep an eye out for the EMS folks and to guide them to where you are. Okay. So don't hang up with the 911 folks until they tell you to. Okay. Moving on to shock. Now, shock, typically, somebody that gets injured, for example, they fall down, they break their leg, or they fall down and they break their leg and there's bleeding involved, or they've hit their head. Those are conditions that could actually lead to shock. And shock is a life-threatening condition that your body actually does. It's your body's response to an injury. And shock can be serious. So there's just a few little things that you need to know what to do in that situation. So if there's bleeding, or if they've hit their head, of course you want to make sure that you address the bleeding. And we'll get to that in just a minute. But make sure you treat the injury and then treat for shock. So you're going to have the person lie down flat. Okay. If you're at home, have them lie on a couch. If they're on the floor, don't move them, but make sure that they lie down flat. Then keep them calm. Remember, always keep your victim calm, and keep normal body temperature. Elevate the legs, put a pillow or two underneath their legs, elevate their legs. What that does is actually get your blood pumping back down to your torso and to your heart and lungs. And of course, it minimizes the effects of shock. So remember that, okay? All right, choking. I'm sure lots of folks worry about choking because that could happen to any of us at any time. So make sure if someone is choking, know the signs. And someone who is, this is pretty much the universal sign for choking. If someone's choking, they're going to grab their neck and, they might not be able to speak because whatever is in their throat, of course, is actually impeding their speech, and they're not going to be able to breathe very well as well. So keep them calm, just reassure them. Now, if the person is choking and they're coughing, so they've been eating something and that they're actually choking on something, but they're coughing, that's a good sign. Okay. If someone is coughing and it's a productive cough, just keep encouraging them to cough and see if they can't remove the object themselves. Okay. So that's always the best thing to do when someone is choking. Now, if someone actually is choking and they can't cough, speak, or breathe, then you have a problem. Because obviously there's an object in the throat that is impairing their breathing, and that is a potentially fatal condition. Thank you, Connie. She's acting this out. So if they're coughing and they have a productive cough, keep coughing, Connie. Good, good, good. Okay, so if for some reason she would stop coughing and she can no longer clear her throat or get any air, then typically a person will not make any noise whatsoever. They might have a little bit of a wheeze, but it's crunch time. So you've got to do something very quickly to help them. So Connie, if you'll stand up, I'm going to demonstrate a real simple technique. So if they have actually stopped, being I guess we're going to have to get down a little bit lower, but anyway, you can see us. What you're going to do is make a fist with your left hand. Okay. You're going to find that person's belly button or their abdomen. You're going to reach your hand around. Okay. And you're going to pull in and up 4 times. Okay. 1, 2, 3, and 4. Okay. Now, you're going to lean her forward, lean the person forward, and you're going to tap 4 times on their back. 1, 2, 3, 4. I hope you guys can see this. I apologize. Okay. Now, if you're able to get the object out with that, you can see it. Great. And the person, whatever's in their throat, it might go flying across the room, or it just might be back in the back of their throat. So if they're actually able to breathe, make sure you tell them to open their mouth. Look and see if there's any object in their mouth. Hopefully, whatever it was that was in the throat will go down. But if it hasn't, then of course, you may do a finger sweep, and you're going to have to go in the person's mouth, do a finger sweep and get that object out, and of course, throw it away. Now, a lot of people think that once a choking emergency has actually come and gone and the person is doing fine, that they don't need to go to the hospital. But that's actually not quite correct. If someone has choked on an object, they do need to go to the hospital and get checked out as quickly as possible after that, because when you choke and you have something in your throat, it can cause an injury to your esophagus. And they need to go in there and actually look and check and make sure that everything, your airway is clean, that everything is out, and that it didn't go down into your lungs, because that's a whole nother situation. So that can make you sick as well. But always follow up with a trip to the emergency room and get it checked out. Okay. So remember, 4 blows to the back of the torso at the top, right between the shoulder blades, 4. And then, of course, fist in your navel or the abdomen, and you pull up and in towards the rib cage. Okay, 4 times. And hopefully, what that does is actually any air that's in your lungs or in your torso, it's going to force that air up and out, and hopefully, whatever's in your throat will come up and out as well. It's going to force that air out. Okay. Now. Basic first aid with falls. If you have somebody that falls at home or falls in the community, falls can be potentially, fatal. So you need to be careful. If someone falls and they're certainly, if they're not able to get up right immediately, then obviously something is wrong. If someone falls, the rule of thumb is just leave them where they have fallen, keep them calm, keep them comfortable. If you can put a pillow under their head or put a throw over them, remember, keep them calm. Do not move them, because if they have some sort of an injury and you try to move them, or you try to get them to walk or to stand, especially if you get somebody who's fallen and try to stand too quickly, they could pass out again. So just keep them calm. Do not move them until the emergency squad arrives. And of course, you can tell the emergency squad, what has happened and where you think they might be injured. Okay. So always make sure you call 911 and get help. All right, nosebleeds. Nosebleeds happen to all of us. I'm sure, many of you have had a nosebleed at one point or another, and they're not fun. And there's all kinds of methods out there on the internet that tells you how to deal with a nosebleed. But in terms of what the Red Cross teaches you, there's just a simple little technique that you can use. And Connie's demonstrating that, and I'm going to demonstrate it too. You simply take your thumb and your forefinger like this, pinch your nose on either side of your bridge, okay, lean forward slightly, and hold that for about 20 seconds, and then release and see if you're actually still bleeding from the nose. Do it again, okay, and hold your thumb and forefinger on the bridge of your nose and pinch, okay? And what that does, hopefully, is get the blood that's in your nose to clot, okay? Nosebleeds can be a bad sign for a lot of folks. People with emphysema, people with allergies, any type of, upper respiratory infections, you can get nosebleeds from those. And some people actually just have a predisposition for nosebleeds. So it can happen at any time and anywhere. So the best thing you can do, pinch the nose, lean forward, and apply pressure to the bridge of the nose for as long as it takes to stop the bleeding. So if your family doctor says, okay, you don't really need to go to the hospital for a nosebleed, that's fine. But for some people, a nosebleed out of the blue, and you have no contributing factors to it, there's something wrong. So it really wouldn't be a bad idea to actually go to the hospital, to the emergency room, and get checked out just to be on the safe side, especially if for some reason you're not able to stop the blood flow, okay? Because nosebleeds can look a lot worse than they are. You tend to bleed a lot from your nose. So keep that in mind when you're helping someone with a nosebleed. But that's just a little hint on how to stop nosebleeds, okay? All right, wound. Now, if it's a small enough wound and there's blood present, you want to stop the bleeding. So I'm going to show you real quick on how we do this. And it's really simple in terms of stopping the bleeding on someone. You can use basically a clean cloth, a dish towel, anything. If you have a first aid kit, we'll get to that in a minute. If you have a first aid kit, you can use your first aid kit. There's usually gauze pads. They'll look like this. Sometimes they're a little bit bigger. But what we're going to do is we're going to apply pressure to the wound, and then we're going to wrap it up. And if it's bad enough that you think that it's going to need stitches, go to the emergency room immediately and get help, okay? Because those can be, there's always a risk of infection. So let me show you. I'm going to use this arm. Okay, so we're going to pretend Connie has quite a big gash on her arm and she's cut herself. So what I'm going to do is I'm going to apply pressure, and I'm going to put this gauze on her arm, and I'm actually going to press down, not hard, we don't want to injure the person, but hard enough that we can actually try to stop the bleeding. Then we're going to take what we call a roller bandage, that looks like this. And you have these usually in any standard first aid kit, okay? Sometimes they're really long. So what we're going to do with this is we're also going to stop the bleeding and apply pressure with a direct bandage. So let me show you how to do that. We're going to wrap that gauze, those gauze pads, and I'm going to have Connie apply pressure while I'm wrapping, okay? And we're going to wrap it as quickly as we can. Try not to make the bandage too tight, folks, because if you do, they might lose feeling in their fingers and their hands. So always make sure that they can wiggle their fingers. Can you wiggle your fingers? Yep. Okay. So just make sure that if her hand would go, unusually white, pale, and they don't have feeling in their fingers, then that's the situation that you need to relate to the EMS folks if you've called 911 and the emergency squad is on the way. Or if you're taking them to the hospital to get stitches, you can tell them there. But just make sure that you don't wrap this too tight, because you don't want to cut off the circulation, because that would not be a good thing. Okay, you're going to actually make it worse. So we're going to finish wrapping up this this wound. And what I'm going to do, simply since you don't have to use tape or any other fancy stuff, you can actually just take part of the bandage and the end of the bandage, and you can actually tie it, especially right above the wound. And that will also put pressure on it as well. And that's kind of what it looks like. I hope you guys can see that. Can you see that? Okay. So, all right, wounds. So always have the victim lie down if you can, because that does help with bleeding. Okay, when you're standing up, you tend to bleed a little more. So make sure that you apply direct pressure. And then of course, if you have the right materials and you can use a bandage, you can bandage it up, you can apply pressure, or you can get them to the emergency room as quickly as possible. Okay. Now, animal bites. Lots of us have pets or service animals. So if for some reason someone would get bit by an animal, those are always potentially dangerous, and you do need to go to the emergency room, okay? Don't try to treat that at home, and don't ignore it, because when you get bit by an animal, they have a lot of bacteria in their mouth, and you can get an infection from that. So that's a pretty serious issue. If you have to have stitches, wound care in terms of cleaning out the wound, you want to make sure that you tell the folks at the emergency room what happened, what kind of dog you think it might be. And also, if it's a dog you've never seen before, it's okay to say that. Hey, it's a dog that I've never seen before. But if you know whose dog it was, when you get to the emergency room, they're going to ask you whose dog it was, because they will actually notify animal control with that too. There's some procedures in place that you actually need to follow, and they'll walk you through that process at the emergency room. Okay. All right. Now, electric shock. Electric shock, always a dangerous thing and always potentially dangerous to you actually responding to the emergency. And, at the Red Cross, we use this example. We have a lot of storms here. And we have a lot of issues with downed trees and downed electrical lines. And if you have a downed electrical line over a road, for example, and it's been raining outside, what do you think that would actually cause if it's been wet and there's electricity, an active power line? Well, that could actually cause you to get electrocuted. It could cause further injury to the person who may be electrocuted. So really the only thing you can do is call 911, get help on the way immediately. And of course, once EMS gets there, they're going to know how to respond to that emergency as quickly as possible. If you can actually help the person away from it without getting hurt yourself, that's okay too. But remember what I told you, always take your safety, always take that into mind when you're actually responding to an emergency. You don't want to get injured yourself in the process of trying to help someone else, because if something would happen to you, then there's nobody else to call 911 and get EMS on the way. So always be conscious of that, okay? Don't touch the person if they're actually still, around the electric or around water, because you don't want to get electrocuted yourself. Now, with water rescue, if you're, enjoying a great day at the pool, or you're rafting with friends on the river with some rafts, always make sure that you have the proper safety equipment. Make sure that you're wearing a life jacket. Make sure that you are aware of your surroundings. Do not go out into moving bodies of water like the river, especially large rivers like the Ohio River, the Kanawha rivers. You don't know what actually the current's going to be like. So you can, you really get into a lot of different situations with a water rescue. So the main thing I want you to remember is if you have the proper equipment on, like a life vest, if you're actually in and around water and you can't swim well, always use a life vest. Okay. If you're in a boat, always use a life vest. I mean, that's the law. But if you're at the pool, and of course, not everybody uses floaties or life vests at the pool. So typically, if you're trying to help somebody who is drowning in a moving body of water or a pool, you can, reach something to them. If you're in a pond and the person is having an emergency and maybe potentially drowning, you can, throw a stick to them, hold on to a stick. They can hold on to the stick. You can pull them to the shore. If you have access to a flotation ring, those are those big rings about yay big with a hole in the middle. You can throw that to them. They have a rope on them. You can pull that back. You can assist them that way, but always get help, because a person can drown in very little time. So make sure you get help on the way as quickly as possible, and get EMS folks on the way. Okay. All right. So for first aid, that's pretty much all I have for the basic of first aid. There's a whole nother section with first aid that gets into the nitty gritty, and we can do that when we're actually meeting in person again, like we did before. And those are things that happens when you have allergic reactions or poisonings, etc. But in the interest of time, I've kind of condensed it a little bit to just the basics. And I'll take a 10-minute answer session